Hi, you guys. Welcome back for our daily practice questions. It is day 157 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, maintaining a 99% pass rate. But y'all know my disclaimer and reminders that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Before we get started with our questions, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like access to my MP Test Success Toolkit, it is free and linked in the description. Also, y'all know my website is updated and live with all of the resources, whether you're a first time test taker or retesting. All of the resources are provided based on whatever your scenario is, and it will guide you through and give you the background and all of the details that are included with each resource. So if you're looking for that, just click the link in the description, or if you look at the beginning slide, circled here is the website link. All right, you guys, let's get into question number one for today. Question number one states, a 38-year-old patient presents with classic symptoms of GERD, including heartburn and regurgitation occurring several times per week. What is the most appropriate first-line pharmacologic treatment? Is it A, H2 receptor blockers as needed? Is it B, a proton pump inhibitor once daily before breakfast? Is it C, antacids after each meal and at bedtime? Or is it a prokinetic agent um, such as metoclopramide? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most appropriate first-line pharmacologic treatment? And you know what I tell you? Anytime it's asking for a treatment, you got to run it back and look and see if they have provided you with a diagnosis. In the event that they have not, you need to run it back a step further and look at those assessment findings so you can determine what it is so you know how to treat it, right? Because you got to know what it is to treat. So here it gives us a scenario that the patient presents basically with symptoms of GERD. So the nurse practitioner is suspecting GERD as a diagnosis. So remember, the latest guidelines state that we treat first with a PPI. Now, if they were just saying they had various symptoms periodically, and GERD wasn't either confirmed or a true diagnosis, then we would go with an H2 blocker as needed. But anytime that they are suspecting GERD or confirmed diagnosis, remember a PPI is first line therapy, so B is your best answer. All right, question number two. Which of the following is the best lifestyle modification advice to include in the initial management plan for a patient with GERD? Is it A, increase fluid intake to dilute stomach acid? Is it B, eat 3 large meals per day to minimize acid fluctuations? Is it C, elevate the head of the bed and avoid meals 2 to 3 hours before bedtime? Or is it D, drink a glass of milk at bedtime to coat the stomach? Take a moment and tell me what you got, y'all. All right, so stem of the question here. STEM is the question. Question is the STEM, and it states, which of the following is the best lifestyle modification advice to include in the initial management plan for a patient with GERD? And your best answer is C. You want to tell them to elevate the head of the bed and avoid meals 2 to 3 hours before bedtime. Making sure also when you're educating them to elevate the head of the bed, it doesn't mean just stack pillows because that's not an adequate elevation of the upper portion of the patient's body. You actually want to elevate the head of the bed. Now they have beds that are motorized that can do this, but if not, there are also wedges that can do this, as well as the lifts under the top head portion of the bed that will lift the base of just that portion to give the adequate incline to resolve some of the symptoms when resting. And then lastly, question number 3, a 45-year-old patient has been taking omeprazole 20 milligrams once daily for GERD, but symptoms persist after 8 weeks. She reports good adherence and timing. What is the most appropriate next step as a primary care nurse practitioner? Is it A, refer to GI for endoscopy? Is it B, increase the PPI to twice daily before meals? Is it C, add on an H2 blocker at bedtime? Or is it D, to switch to a prokinetic agent? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, what is the most appropriate next step as a primary care nurse practitioner? All right, so what are we doing now? And then we can decide what should be done next, right? So we have a 45-year-old patient. She's been taking omeprazole 20 milligrams once daily for GERD, but her symptoms are persisting after this 8 weeks, right? She reports good adherence and timing. So, all right, let's talk about what that even means. So, omeprazole, remember your medication endings. Prazole is a PPI, right? A proton pump inhibitor. So, that means that they're on the correct initial medication for a GERD diagnosis. And typically, that 8 week, the reason that that is significant is because even when you're now starting with the latest guidelines that say start with a PPI, they tell you to do a trial period to see if you are starting to get a response to treatment, right? So that also confirms the diagnosis and warrants, how we should proceed or whatever. And so it's showing that she may have improvement, but she is still having some symptoms. So your next best step, because you want to see if they're taking it correctly. So are you taking it daily? Are you taking it, appropriately around meals? And it states that she reports that she does have good adherence and timing. So therefore, you want to increase the PPI to twice daily before meals. That is an option. Guidelines, let's say in primary care, if we have already started them on a PPI, to attempt to give the and they are compliant and taking it as ordered, then you can give them the PPI twice a day and complete this trial period to see their response to it before having to refer them out for EGD or endoscopy for further evaluation and management and treatment. Now, if their symptoms are worsening or, there's completely no resolve, go ahead and refer. So pay attention to the key details. I like to always go over GERD treatment because it's so controversial on things that we initially were learning. Things have changed. Guidelines have changed. Board exams have been updated for the AANP for 2024 in January, and I am suspecting that ANCC will be probably updating later this year. But what they're currently testing on is just this in this fashion. And so I try to deliver it in a manner so that you are able to identify when we start with a PPI so that if you receive a question like that, you'll know how to maneuver, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of my resources, feel free to reach out to the nursing studio. You can give us a call. You can shoot us a text message or shoot us an email at thenursingstudio, the number 1 at gmail.com. But all the resources are linked in the bio of this channel. And if you need navigation to see what works best for our first time test takers, or if you are retesting, go check out the website. It'll walk you through each of those areas to see what's best for you with included details and links for each resource that is available. That is www.thenursingstudio.org. It's linked in the description as well. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.